It is completely normal to notice changes in your body from time to time, and when those changes appear in sensitive areas, it is natural to feel a bit of worry or concern. You might ask yourself, what does this mean for my health, and should I be concerned about a sexually transmitted infection? While it is certainly possible for genital bumps to be a sign of a sexually transmitted infection, it is important to know that they are very often caused by other, less serious conditions. Discovering a bump does not automatically mean you have an STI, and many common skin conditions can manifest in this area. The reason for this variety is that the skin around the genitals is just like the skin on other parts of your body, susceptible to various irritations, infections, and normal anatomical variations. Common non-STI causes can include ingrown hairs from shaving or friction, folliculitis, which is inflammation of hair follicles, or even skin tags that are benign growths. Other possibilities include sebaceous cysts, which are small sacs under the skin, or Fordyce spots, which are harmless enlarged oil glands. While less common, conditions like molluscum contagiosum can also cause bumps and may be transmitted sexually, though they are often self-limiting and not always classified as an STI in the same category as herpes or syphilis. On the other hand, STI-related bumps often present as herpes lesions, genital warts from human papillomavirus, or cankers associated with syphilis. If you do find a bump, the best course of action is to schedule an appointment with a healthcare provider who can properly examine it. Do your best to avoid self-diagnosis or attempting to treat it yourself, as this can worsen the condition or obscure important diagnostic clues. Be prepared to discuss when you first notice the bump, if it is painful or itchy, any recent changes in its appearance, your sexual activity history, and any other symptoms you might be experiencing. Open and honest communication with your doctor will help them accurately assess the situation. Understanding the subtle differences in appearance and location can sometimes offer clues, but it requires a trained. For example, Fordyce spots are typically small, painless yellowish-white bumps, while herpes sores often appear as clusters of small, fluid-filled blisters that can be quite painful. Genital warts, caused by certain types of human papillomavirus, might look like small, flesh-colored cauliflower-like growths. Remember, even if a bump is related to an STI, many of these conditions are manageable, especially with early detection. Ultimately, noticing a bump in the genital area does not automatically mean you have a sexually transmitted infection. However, it is a clear signal to seek professional medical advice. A healthcare provider can provide an accurate diagnosis, offer peace of mind, and recommend the right course of action, ensuring your continued health and well-being.
If this helps you feel seen, like, subscribe, and stay healthy with us.